Welcome to the non-essential ingredients, part of our 7 presentations covering various aspects of nutrition for pregnancy. In pregnancy, there are food types and amounts recommended for optimal nutrition. This is covered in the Nutrition for a Growing Baby presentation, the right foods and right amounts from each of the 5 food groups. However, there are other foods and nutrients that we eat and drink that may influence your pregnancy, and not always in a safe way. This is what we will cover in non-essential ingredients. We will give you the most up-to-date information on caffeine, artificial sweeteners, mercury, alcohol, and food safety, including Listeria, to help you have the healthiest pregnancy possible. Caffeine is a chemical found in some drinks and food. You probably know that coffee, tea, and cola drinks contain caffeine. Caffeine is also found in chocolate and some medications such as Panadol Extra and No-Dose, as well as energy drinks and some sports drinks. Having too much of these caffeine-containing items each day can increase your risk of having a miscarriage or stillbirth, or having a baby with a low birth weight. It has also been linked to behavioural issues in children. Research suggests that pregnant women should limit their caffeine consumption to no more than 3 serves of caffeinated beverages per day, or 300 milligrams of caffeine. For example, 1 espresso-based coffee and 1 to 2 cups of instant coffee or tea would be okay. This does not include those drinks that have a very high amount of caffeine, such as some coffee-flavoured milk drinks and energy-type drinks. These should be avoided during pregnancy. Artificial sweeteners often worry people because they are chemicals. However, chemicals are found in many foods that we eat. Artificial sweeteners are very similar to sugar. However, because of their slightly different chemical structure, they lock into our taste buds a lot better than sugar, which means we use much less because they are intensely sweet. The sweeteners approved for use in Australia, such as aspartame and stevia, are deemed safe to consume in pregnancy. Mercury. Fish is an important part of a healthy diet for pregnancy. It is an excellent source of protein and is low in saturated fat. Fish is also a good source of iodine, which is another important nutrient during pregnancy. Some fish are known to contain higher levels of a toxic metal called mercury. As you go up the food chain, the bigger fish tend to contain more mercury. Mercury has been linked to brain injury in babies whose mothers have consumed too much of it during pregnancy. The easiest way to ensure you don't have too much mercury in your diet is to keep track of your fish intake. If you have 150 grams of shark, swordfish or marlin, then you should not have any other fish or seafood for the next fortnight. If deep-sea perch or catfish is eaten, then the next week needs to be seafood free. It is safe to eat up to 3 150-gram serves each week of any other fish or seafood not listed. This includes salmon, tuna, whiting, cod, and barramundi, as long as it is well cooked and prepared according to Listeria guidelines. There is no known safe level of alcohol consumption during pregnancy, and it is best avoided. Alcohol crosses the placenta and may lead to physical, growth, and cognitive problems in your baby. Drinking alcohol when you are breastfeeding also has an impact on your baby's health. Alcohol can slow your letdown and affect baby's sleeping habits. Your baby may not sleep as well as usual when there is alcohol in your milk supply. Being pregnant means that you have decreased immunity. Therefore, you are more at risk of infection, so care with storing and preparing food is important. Some common foods may pose a risk to pregnant women, as these foods are more likely to be contaminated with a bacteria called Listeria. The risk of contracting Listeria is low, but the consequences may be severe. There is an increased risk of miscarriage, preterm birth, or stillbirth. In some cases, your baby may become very sick after birth. There is a full list of high-risk Listeria foods in your healthy eating booklet, which you would have received on your first antenatal visit. Remember that freshly prepared hot food is always safe. Always wash all fruit and vegetables well, and leftovers should be reheated to steaming hot and be eaten within 24 hours of their preparation. While pregnancy is a time to eat a healthy diet, it is important to also keep a watch on those foods and drinks that aren't quite so essential at this time. Remember, up to 3 caffeinated drinks per day and small amounts of artificial sweetener. Watch the type and amount of fish and seafood that you eat. There is no known safe level of alcohol during pregnancy. Be safe with food storage and preparation. All of this information and more can be found in your Healthy Eating During Pregnancy booklet. If you are interested in further information, specialist maternal health dietitians are available to see all pregnant women. For an appointment to best suit your needs, please see your midwife or speak to reception about booking into our Healthy Start to Pregnancy workshop. Women who aren't delivering at the Mater Mothers Public Hospital are welcome to see our specialist maternal health dietitians at Mater's Health and Wellness Clinic. Phone 3163 6000 to book an appointment or speak with your maternity care provider for a referral. You've just finished the non-essential ingredients. Interested in watching more of the 9 Months of Nutrition series? They can be found at the URL on your screen, www.matermothers.org.au/journey/pregnancy.